Hello, everyone. I'm Laura Andriukaitine, and I would like to welcome everyone to the ESE Live Studio series, a special interview program dedicated to the upcoming ESE Autumn Meeting in Vilnius. And over the coming period, every month we will be speaking with leading experts in endodontics. Our invited speakers giving you a closer look at the topics they will going to present during the ESE Autumn Meeting, also the ideas behind the lectures and the clinical relevance for everyday practice. We'll also be exploring critical questions in modern endodontics, from decision-making and emerging technologies to the challenges clinicians face every day in their practice. Our goal is simple: to connect science with practice and to give you valuable insights you can take directly into your own clinic. But before we will start with our main guest for today, I would like to introduce to Monica Freire, who is the CEO of the ESE, and she is already serving for the 2 years. Hello, Monica.
Hello, Laura. How are you?
I am fine. And you, Monica, are, I would say, a key person that controls our office, our ESE office, and all the processes there.
Well, absolutely. We are a small team, but eager to make things happen for ESE and to bring the most value to our members that we can. So I'm really excited to be here for the first session of the Autumn Meeting preview with you. And thank you so much for handling these sessions, preview sessions with us, and with a very, very special guest today, right?
Yes. So it is a pleasure to have you on board, Monica. And for the participants, I would like to say that Monica will follow our chat section. So do not hesitate to comment and ask questions. And we will try to answer them at the end of our talk. And probably Monica will stay at the backstage all the time while we will be talking with our main guest tonight.
I'll
Thank
see you in a minute. Thank you.
you. And also, I want to say big thank for one more lady behind the scene, and she is Viviana Estevao. She is serving at the ESE just recently as a project manager and communication manager. So she is behind the scene, and she is taking care that our interviews would run smoothly all the time. Thank you, Viviana, and thank you, Monica. And let's begin. And it is my huge pleasure to introduce first our guest. So very famous one, Professor Gianluca Gambarini. Hello, Gianluca.
Hi, Laura, and hi to all of you, also to Monica and Viviana, and compliments for all the work and efforts that you've been done to make this event.
So I would like very shortly introduce you. I think there is no need for in-depth introduction of you because you are one of the most famous figures in our contemporary endodontic, holding the authorship and co-authorship of the hundreds scientific articles, having decades of teaching and scientific career, and simultaneously working as a clinician for many years. You also consult and collaborate with the industry to implement new techniques, giving the best of your scientific and clinical experience. So it is my pleasure to say hello to you, and also, first of all, to congratulate you for becoming the president of ESE. And I just wish you big success in leading our society. That is important and not the easy task.
Well, yes, but I've been in ESC now since really a long time, and actually I've seen it booming in the last years, and also endodontics booming as a specialty, becoming more and more important. So this is a trend nowadays. More people want to treat their teeth, save the teeth, and that's why we need endodontists and we need good quality and we need to improve the level of this specialization in a certain way in Europe and ideally worldwide, because from a social point of view, it's very important to save our teeth. It's our mission. It's the mission of our society to improve the knowledge to allow all our patients to be successful.
Yeah, and Professor Gambarini, maybe I can call you Gianluca. We are friends for many years as well. So,
Yes.
Gianluca, stepping into the role of the ESE president is a major milestone, I think, yes? How does it feel to lead your first Congress in Vilnius? And maybe you also can start with a little bit of explanation about the ESC events, because we have two of them. We have biannual Congress, which is the biggest one, and the ESC Autumn Meeting that we've started to organize as an open meeting since Krakow.
Yes, actually, it's very different because, ideally speaking, the autumn meeting is a smaller meeting, but it's also with a different structure. It's only one big hall, and here there's only one scientific program. So there's actually no choice, but there is a lot of possible interaction between participant and between speakers. So actually, I think it's a very, very concentrated meeting where you can really meet all the participants, and that's very nice also for the participants, the students, the old doctors like me. I mean, to share the knowledge and discuss about the topics in endodontics. The biennial meeting obviously is a much bigger event with a huge participation, a huge effort, and it allows to be more widespread and have many participants coming and to speak. Also, they present their work, their research, and like this. So actually, we had a record last year of more than 800 presentation and posters submitted to the ESE. That shows how life is the endodontic world nowadays. The autumn meeting, on the other hand, is only by invitation, meaning that the speakers are invited speakers only. But there is a reason why we do this that we will explain this. And recently we introduced new things that because we saw so much interest in new technologies, in new techniques that we are starting some poster presentation. So everyone that want to show his recent results or even continue to show the results of his research year by year can do this.
Yes, and actually we can say from Krakow that it was a lot of interaction during the autumn meeting, and the question and answer sessions were even too short to discuss the things that were very freely shared in the small company. I think it was very cozy, it was very nice company, and we learned a lot during these questions and answer sessions as well. So automatic is very special. I think it is a bit different and also it brings a different insights and different benefits, I think so. So let's go to the autumn meeting in Vilnius in the program. Looking at it, it feels very thoughtfully structured. Could you walk us through the philosophy behind it, and how did you and your team decide on the key themes and topics?
Well, actually, that's been a teamwork. It's not only the president, but also we get, the help of the committees, the research committees, and the clinical practice committee. Because the idea here is to describe a topic from two different perspectives. The research one, which is very, very interesting because actually our field should be evidence based. But then on the other one, the clinical part, which is also very interesting because then you have to apply the knowledge into clinical practice. And so in clinical practice, there's also a lot of small hints and some interesting suggestions. By having for each topic two leaders, one in research and one in clinical practice, I think that we are able to give the participant the same topic seen in two different ways, in two different perspectives, and that becomes very, very interesting because it's totally new in in the way we do this. And we already experiment this, and it was very successful because of this, as you told, interaction. But interaction were because the topics were interesting and the speakers were really very good. So we are now this year we would like to replicate this kind of model, and hopefully the teams that we selected very carefully is those who are a little bit more controversial and also a little bit more difficult to treat clinically. And so I hope that there will be a lot of interest from the audience.
Great. So that was actually intention to create a progression from fundamental science to real world clinical application. I think this is just a ping pong, yes.
Yeah, well, because ESE is very, let's say, well known for the quality of the research. We have an excellent journal thanks to the our past president, Professor Duncan, who's the chief editor. So we have, this tradition of science, but obviously the science itself then must be applied science, and this is why I think it is so interesting to have these different perspectives to be shown in the same meeting, and so the person can listen also to some controversial things, or maybe they all agree about this. We still don't know. It's that that makes the meeting very lively, and this is what catches the attention and the interest of the people.
Okay, so there is a clear balance between innovation and daily practice. So
Yeah.
how did you ensure that the program is relevant both for highly experienced specialists that we have in our majority in our society and for clinicians looking to refine their daily practice and daily decision making? Let's see,
Yeah,
Gianluca.
well, yes. Well, as the first thing is very important here is the selection of the topic. For example, we selected 4 topics that are very, very, debated currently. For example, I will mention all of them. One is vital pulp therapy. Okay, there's a lot of questioning about what can be achieved, what we cannot be achieved, when to do it and when not to do it. And then, but also, we also know that the outcome of vital pulp therapy is also depending on how well is performed the procedure. So now, as you see, we have a theoretical problem, and then we have a lot of study, suggesting one technique versus the other. But then also we have to perform these techniques, and sometimes it's more easy, sometimes it's more difficult. So the two things obviously have to go together. And we have an excellent speaker, but also the same thing for the other 3 topics. One is crack and fractures. So this is also a topic which is becoming very, very popular nowadays, with also the AI, artificial intelligence,
Yes.
trying to get into the diagnosis and help the dentist. So it's not only a problem of, diagnosis, but it's also a problem of management of this kind of situation, where we can manage or what we can do. I'm just saying an example which probably will not be addressed, but I will tell you now. If there's a root fracture and you have to lose, your tooth, implant is not the only alternative. You also may use intentional replantation of a tooth. That's a possibility, and which is more conservative or an endodontic, in a certain way, therapy. So actually, you have many problems. Also, the other thing is calcified canal. So there's a lot of, knowledge about how the calcification occurs, when and how to prevent. And but also then you have to deal with calcified canal. So then you have to know which is the best technique, which are the instrument. Even if you want to do freehand or guided endodontics, there's so many aspects that we could discuss. And last but not least is retreatment and outcome. many ways of doing the treatment and many possible outcome. And also, we will talk about what's the alternatives and how the endodontic choice perform compare with the other possibilities, which is mostly implant. And I know the speakers, I know a little bit about the lecture. I don't want to spoil anything, but I can tell you that this will be very, very interesting lectures because the topic and because of the speakers.
Absolutely. So let's talk also about additional sessions. The program also includes scientific poster sessions and hands-on
Yes.
courses, if they will
Yes.
be included. So how important are these elements in shaping the overall experience of the Congress?
Well, the idea of having poster here is that also allow, participant to promote their research, their ideas. So actually, in the ESC, we wanted to have a big podium, and obviously, we are obliged by the meeting itself to have one big hall and close discussion, but there is a possibility for student researchers, and I really encourage young people, young researchers to use this posters presentation in this very important international congress to promote a little bit themselves, a little bit their research, a little bit their programs if that's a university. And I have to not to forget, Laura, also that we also have another small presentation during this meeting from Liselotte Kirkevan about
Yes.
we made a new diagnostic classification for diseases in connection with the American Association. So actually, we're also in a certain way will make a small lecture about this because I think it is very important that we all over the world we use the same terminology when we describe pathologies and diseases, and this is very very important. And this we made such a big work also thanks to Al Duncan to try to harmonize this all over the world. So this is one of our mission is to raise the level of endodontics in every possible situation.
Thanks, Gianluca, for this excellent overview of the program. And now I want to ask you some questions as an expert, as a long-time expert in endodontics.
Okay.
Also related to the
Can
program.
I say something that because you say long time expert, blah, 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 many years, I totally agree because I graduated when I was 6 years old.
Come
So
on.
otherwise, the people get confused. I'm joking.
Yes.
Okay, let's go. This is a little bit
So
break to laugh a little.
yes,
Yes.
let's come back. So one of the key topics in the program is clinical decision making, particularly when we
Yes.
choose between retreatment and implant therapy, as you already said some words.
Yeah.
From your perspective, from your expert's perspective, what are the most critical factors clinicians should evaluate in such situations?
Ah, this is okay. Well, first of all, in the past, let's say in the past, because nowadays it's changing. Uh, Clinician decision making was based on expertise, was making on experience, and now it's slightly changing because we have artificial intelligence that is coming into this and is able to collect the overall experience of many clinicians. But still, I think that's I don't want a world where robot decide
Robots
about our health.
ruling.
Yes. So I hope that the robot will help us, and I think that the robot can help us because they are never tired. They are able to look at very small details that sometimes we are a little bit distracted. But at the end, what is very important is that the clinician and the human being still have a knowledge that can allow them to make the best solution for the patient. So this is for me, it's fundamental. And I always teach my student that, okay, in terms of clinical skills, you can be a little bit better dentist or not. But if you make the wrong diagnosis, then you're not a good dentist at all. So this is so important that you understand the problem, know how in a certain way, which is the different pathways, because you can solve it in many different ways. Then you may decide which is the one you prefer. But if you make the right choice from the very beginning, then more or less you will always be successful. It can be a little bit more, a little bit less, but at the end. So this is important. So the technical, skills then will help you to become more and more successful. But if you start wrongly, then it's very hard to solve it.
Yes, and we can see that, yes, artificial intelligence is evolving, and of course, there will be a huge revolution, I think, a real revolution in our practice. However, we also have to use our brains, because so far artificial intelligence is not 100% correct, and it hallucinates and makes errors. And if we don't know, so that there can be a disaster for our patients. So we have to control.
Yes, I will make you an example just to laugh a little bit. So the artificial intelligence will tell me that I have to treat this second upper molar and endodontically. But then the patient doesn't open the mouth because it opens like the mouth like this. So what I would like to say, I will ask to say the artificial intelligence, please come here, open the mouth of the patient, and please do the treatment for me. Because it's easy to say, okay, this is the best option. Yes, but then the best option is related to what you practically have with your patient there, like this. So this, once again, I love science. I love, the reasoning. I love everything. But then there is practice, and practice is like in life. It's not always same as theory. Let's put it this way.
Absolutely, yeah.
Yeah.
So let's move on. Modern endodontics is evolving rapidly, especially with new technologies and materials, also artificial intelligence including. Do you think clinicians today are facing more clarity or more complexity when making treatment decisions?
Okay. Well, I will just make an example because many years ago I started to be very fond of CBCT. And when I started lecturing about CBCT, I really understand the importance of the anatomy. And obviously, if you have a CBCT, I just make an example. If you have a CBCT, you will no longer miss canals, which was one of the most common mistake 10 or 15 years ago. One of the most common mistake, for example, was missing the MB2. Yeah, now the problem is that the technology helps you to make a better diagnosis. So you know that there is MB2, you know where the MB2 is, but then the CBCT helps on one side, but on the other side, the CBCT now helps, doesn't really help you in treat the MB2. So now you must have your clinical skills in order to treat the MB2. So it makes your life more difficult because before you could simply ignore the MB2. I just put it. So pretend that there was no MB2 and that you were happy. Now, if the CBCT tells that there's 5 canals or 6 canals in a molar, then you have to not only to find all of them, but you have to treat them properly. So in a certain way, it helps, it makes things easier, but also makes things a little bit more complex. So as a matter of fact, I think that's, once again, as you see, theory and practice and
with the
knowledge
instruments,
and skills. Yes, that is.
Yes, with the instruments, we have so many systems. All of them are according to manufacturers and according to the KOLs, key opinion leaders. They are excellent. They are brilliant. But the choice becomes a little bit difficult, yes, for the general practitioners, for the normal, let's say, users, not so advanced, or let's say, I think it's a little bit more complex, and therefore we have to have the skills how to distinguish what is good for us, what is good for the patient, what is good for the clinical situation. So a big choice also make a confusion, no?
Well, on one side, yes, and one side, no, because let's say that's a bigger choice. Provide. It's like when you go to a restaurant. Okay, if we have a lot of dishes, it's good from one side because you can taste a lot. But then, I mean, you have to choose, and you always be a little bit confused. But I don't think the people prefer to go to a restaurant when there is only one dish because they're obliged to do this. So I see this as a progress. I see that I think that the more instrument that we have, the more technology, it's definitely a progress. You are correct when you say that this progress should be in a certain way should come with some help about the manufacturer. Now, the problem is that you cannot tell the manufacturer, well, I'm also sometimes I'm an inventor also. I have some patent, and when they ask me about the inventors, and I say it's obvious that an inventor made his best when he invented something. So if you ask him what is the best, he will say my thing because he did his best to do this. So this is why if you speak with manufacturers, they will tell you all the time what is good about the instrument. But what is the role of the science? What is the role of our association? Actually, is to present. I mean, this innovation and this advancement in a very, I mean, clear way, with non-bias, in a very honest way, so you can tell on the podium which are the good and the bads. Because actually, as like everything in life, there are some advantages and some disadvantages. And what we need actually is to have, and this we can do from our journal or from our association, a clear, an honest analysis of. I'm speaking about the instrument, but it can go with every device and every innovation in endodontics. So that's why it's so important. I mean, to go to this kind of meetings where it's really evidence based and it's also practical, because once again, what I say is that some, and this I can tell about the instrument, some instruments are, could be in a certain way better or could have some characteristic. But then, what you like, Laura, maybe not what I like. The way I use the instrument is different from yours. I may use a different pressure, a different force. So I could be more confident on one instrument versus the other. So I always say that there is good and bad in everything. The only thing we have to understand precisely the good and bad. And this is why, we should attend this, Congress like the ESE, because to give the correct information. And then obviously in this Congress, you also have the sponsor, and you can also go there and listen with what they say, which is obviously correct from their own perspective, because
Yes.
they want to make the best file ever, because if they make the best file ever, they sell it more. So this everyone wants to do the best, but everyone also has to have the critical understanding and the knowledge of the problem. Yes,
Yes.
so
So
that's why.
actually, you answered my one of my questions, one of my following questions. So let's go to the value of the Congress. Who should attend and why? If you had to so what can you say about that? Who do you believe will benefit the most from attending these autumn meetings? Is it primarily dedicated for the specialist, or is it the real value for the general practitioners, for the students, for young career colleagues? What is your opinion?
The value is for everyone because endo is so interesting and so nice, but it's sometimes also a bit complex. So I'm an endodontist, so every time I'm doing a case, I'm never sure. So meaning that I know that every case can also hide a very complex challenge. So I think that you can always learn from a congress like this. So anyone, obviously, some people will learn more, some people will learn a little bit less, but at the end, every congress that gives you at the end some very good knowledge and some very interesting clinical tips and tricks, it's
Yes.
a wonderful congress. So everyone should attend, and everyone will like what he or she would prefer. So, but I think that with this kind of meeting from the ESC, I can be 100% sure that everyone can find a lot of interesting things. And what's most important, that many of them he can incorporate when he goes back and or she goes back to the office in their daily practice. So this is very important. So everyone is welcome, and we try to welcome from the students to the old guys like me, and because all of them have a possibility to learn.
Of course. And especially that can be a first step for the young practitioners, I think, because there will be a huge step forward in gaining some clinical tips, as you said, and also some really valuable scientific insights
Yes,
in the
I will say
daily.
something for the young people, because I'm an educator at the university. Obviously, university, I mean, has to teach in a certain way at least the basic endodontics. While here in this kind of congress, they can also see how endodontics can also be performed at a little bit more complex level, because there are easy cases, medium cases, and very, very complicated cases. So actually, I mean, in the university, apart from postgraduate, but the undergraduate curriculum like this, they usually learn mostly basic or advanced endo, but not the the newest thing. And also the other thing is that new things are coming every year.
For
So
sure.
new techniques, new discover. So it's so important to get a little bit updated with both research, but also clinical devices or clinical techniques. Yeah.
Yeah. And also when I talk with people, they say, yeah, this is, this is for only for those who love endo and do endo every single day. But in general, everyone, general practitioner is doing endo. They facing endo, and probably they can start loving endo more, or start loving instead of hating, because they will see how to manage some cases that really that they are struggling with. So Gianluca, let's move ahead. You are inventor, so you are like a visionary as well. Let's say in general, looking ahead, how do you see the future direction in endodontics evolving?
Ah,
Artificial intelligence, robots?
no, 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 no. Okay. Well,
Let's say I can add a little bit more on that. Are there any emerging concepts right now or technologies that you believe will significantly change the way we practice?
it's difficult to say what does significantly. I think that many things that can significantly improve. Well, it depends. Maybe not only the quality, but also the simplicity of the treatment, or the predictability of the treatment. So there are many factors here that can be analyzed. What I'm telling you is that. Speaking about robotic artificial intelligence like this, I mean, we are thinking nowadays what kind of jobs will be preserved in the future, because a lot of things will change probably in future. and some people think that okay, artificial intelligence will make my work, and I will stay home and get paid. I don't know if this will be the case, but actually, I think that endo, because of the complexities of the anatomy and the different situation, will still be something which is very, very hard to, I mean, substitute with robotics. Uh, I have to make a small thing about artificial intelligence, a definition. There are two kinds of artificial intelligence, the diagnostic one and the robotic one. The diagnostic one, I think that will come in endo, like in dentistry, in all the fields. But the robotic one will probably work only in some fields, not in all. And one of these fields will not be endo because it is a little bit too complex to think that a robot will come and do the whole endo treatment. And while in other specialties, it could be that the robotic influence will be much bigger. So the young people that comes to an endo and becomes a very good endodontics probably will still have a future in the next year. And the last thing I want to tell you about the importance of endodontic is not for a purely commercial side of your office. Many patients, I mean, a lot of patients come to your office because they have pain. And one of the major reasons of pain is an endodontic problem. So if you are good at endo, the first impact, the first meeting with your patient will be very successful, and this will start your relationship with patient in a very positive way because they will be very satisfied with what you do. So knowing endo or knowing to make diagnosis and knowing how to face clinically the problem of pain, it's a relevant issue that can make the difference between one office and the other office. So this is also another point that we sometimes forget because we think, okay, in some fields you get more money, less money. Some other fields are more easy, more relaxing. But once again, endo sometimes is the chance for you to get the patient close to you and coming to your office. And if you do things well, they will be patient forever. And this I can tell you, this I can really tell you from my long time experience because it's so happy I am when I see patients that have root canal treatment done by 30, 35 years and they are still there. Their team and the patient are so happy. They say, "Oh, doctor, you made really a great work." And this is for me the most, happy moments during my practice to see that we are doing something that really makes the good for our patient. And
Yeah.
yeah,
I wanted to ask you like a last question. What continues to inspire in endodontics after so many years at the highest level of profession? And probably this is like a possibility to save the teeth, to get rid of the pain, and yeah, to elevate the quality life of our patient.
I will. If we speak about robotic and we speak about robotic, I would not like to have some part of me substituted by a robotic appliance. Well, some people would like, but I don't like it. So I wanted to have what nature and what God gave to me. So God gave me my teeth. So I want to preserve my teeth. And I think that nature and God made my teeth in the best way, in the best possible way. And yes, so and if I can keep this way, I'm more than happy. So that's why I'm an endodontist probably.
For
But I
sure.
think that, but I think that honestly, if we ask the majority of dentists, what would you like to have in your mouth? I think that
Definitely.
very few of them will say Toronto Bridge.
Of
They
course.
will say all my teeth. So let's promote endo.
For
And
sure.
ESC, yes.
Yeah. Gianluca, anything we forgot to mention during our interview? Thanks a lot for such a nice and such a
Yes.
relaxed atmosphere. Actually, we are going to have such interviews with all our guests. It's not only about their topic, but also going beyond their topic, just discussing and asking their opinion as the experts, because we are top level experts of our specialty. So anything to add from your side?
Yes, I think we forgot to say two things. Number one is that a Congress is also not only science, but is also relationship. So I think the atmosphere in DSC that you will find with also with the participant, with the speakers, but also with the sponsors and the organizing committee. I hope that you will find a very warm and friendly atmosphere because I mean all have a common interest. We love Endo, and so we always are smiling and we are positive about this. So this is number one. Number two is that because of this, we will learn a lot from the Congress, but also we have an opportunity to visit very beautiful cities. So we'll have this Congress in Vilnius, and I'm very enthusiastic to discover the Baltic area, the Baltic culture, and well, the Baltic weather. Let's say. Let's hope that it's nice. And obviously, this will be meeting in Vilnius, but also being Italian, I will also have to promote the our biennial congress in Rome. So actually, this is why we carefully select, the city in order to have, a good combination of, in a certain way, new and old, east and west, north and south, and different flavors, different societies, different culture, because at the end, all these things are different and interesting, but we all share a common interest and a common passion, which is Endo. And this should be, the ESC main effort to promote Endo. Okay.
As I can say, we say there is no bad weather, there is only bad clothes and bad company. So just bring the correct clothes and the company will definitely be the best possible. So thank you, Gianluca. And probably we can call Monica Freire on stage to join us. And maybe we have some questions from the audience.
Hello again.
Hello.
Yeah, I wanted to ask you, do we have time for two quick questions?
Yes, I think so. We are not
Are we
so
okay?
limited
So,
with time.
first question from the audience. What is one common mistake you still see in clinical endodontic decision making, Gianluca?
This is retreatment cases, and retreatment cases sometimes we made a wrong diagnosis, especially it's with vertical fractures, and we decided to retreat. We, we retreat cases that it's lost, and the other mistake in retreatment is that we do not recognize sometimes the real mistake that was originating the pathology, which could be a miscanal or a ledge or something like this. So actually, it's in the retreatment case, it's so important for us to understand not only to decide the treatment, but to see what's the reason why the treatment failed. So my answer to this question is this: it's very important that you know and understand why a case failed. Then you will find a solution, or will try to find a solution how to solve it. But if you miss this kind of reason, then you will guess. So sometimes you find a good solution, sometimes you don't.
Lovely. Question two, another practical question. So, how do you see the balance between preserving natural teeth and implantology evolving in the future?
Okay, uh, I will tell you a story. Many years ago, I was in a special event in New York, and it was joining the most relevant endodontics and implantology about this question: what's the future? And this was by the industry, and this was something like 1999, so last century, at the end of last century. So at that time, the idea was that frontal teeth will be treated by endo, and what was premolars and molars, that implants will be the best choice. So nowadays, after nearly more than 25 years, and after getting the experience and and all the results, the outcome, long time, we no longer think this way. And this prediction was made by, let's say, famous and well-known researchers and clinicians, and the most important manufacturers of implants and and endodontic products. So actually, I mean, we are human beings. We can make mistake, and also we can also make wrong thinking about the future. Actually, if I if I knew the future very well, I will go and New York Stock Exchange and will invest, put my money and my friends' money on what's the future. So we don't know the future, but actually, I would say that's as I explained you before, if the nature created the tooth in a certain way, probably there was a big design after this. There was an evolution of millions of years that decided the tooth to be this way. If you remove a tooth and then put something which is similar, it is similar, but it's not the same. So there is a potential risk that it will not work exactly in the same way. And if
Mm.
it works better, we are all happy. But if it doesn't work better, we are all very sad. So since this is a very questionable problem at the moment, I still want to preserve my teeth and wait after more 25 years to get probably the final decision whether it's better to have a tooth or an implant. So I think I will answer in 26 years.
We'll take note of that.
Yes.
Yes. So actually, we have to save our teeth as much as possible and not to give up until the last time when it's then when we go to the question of preservation of the bone. Yes, but
Yes, and having said this, Laura, what is very important, I want to say that we have to be reasonable because we cannot make the opposite mistake. We cannot overtreat. So meaning that if a tooth is lost, is lost. We should not try the impossible, and because I mean we also have to assume that a tooth is better, but it's not possible sometimes, or it's not really. I mean, an advantage for the patient to keep some tooth
of course,
in some special cases.
yeah,
So, I mean, so we have to do a proper diagnosis and try to
according,
do the best for them. Yes.
yes. So thank you very much. Thank you very much, Gianluca, for joining us. And as I said, good luck with your presidency. 2 years
Yes.
ahead. Two very important meetings ahead, autumn meeting and our biennial congress, which will be held in Rome. Fantastic city, I think it should be a huge success. So I just want, on behalf of all our team, to wish you all the best. And also, we would like to announce that every single month, starting from now, we will have new guests from the autumn meeting who will share their also expertise as Gianluca did tonight. So thanks a lot for those who are joining us. Of course, all those videos will be uploaded on the social media and also on our YouTube channel. So you can still continue the conversation. You can still continue asking us the questions and we will try to answer them. And see you next month with our new guest in our live studio. Thanks a lot and
And see you in
good night
Vilnius.
or good day.
Okay.